receptive structures imposes an awakening by putting forward in our face all kinds of problems, which in a large majority deserve to be addressed long time ago. Across the negative aspect, it also offers an opportunity to learn how to make things differently by adopting, before all, more fair guiding principles, values, which have always guided us at MSH in our daily work, and to ensure more sustainable achievements in our mission while promoting the concepts of equity and social justice. However, the challenges we are facing now are not the least, because it is a question above all of drawing from so many disappointments, frustrations, and negative aspects, the force, the will, and the courage to adopt a common vision that transcends our individual and petty interests, to set up effective and efficient strategies by coordinating our actions and by focusing on accountability, results, for a better response to the tangible community needs for which we want to make and prove a difference in their life. How to arrive at this ultimate empathy. How to sublimate our soul and be the voice of the voiceless, so that children and youth, as we have been one day, can be in good health, well educated, thus representing a promising future, a balanced and stable labor force, and able to take care later of their family, and ensuring us to be on the path of development. How to manage and change the behavior and beliefs of these 52% of women of our population, so that finally they cease believing that procreation is a way to succeed, because the success of one of their offspring will end the misery of their entire family. How to manage to frame our leaders by helping them adopt a common vision and this essential leadership to fulfill their function to the satisfaction of those who choose and even elected them in a spirit of equity and social justice. How to arrive at this single symphony of our partners and donors, when each one plays his own part, thus bringing about effective coordination, rationalization, and integration. I could continue to ask questions, but these are illustrative examples to which we should find articulated answers together as privileged people in order to be in peace with our own soul. Fortunately, in this country which seems to have the name of nowhere, certain aspects are less dramatic, and believe me, there was still space for worse, as I often repeat to my friends in front of any unwelcome or unsolicited situation. Indeed, unfortunately, in this country, which looks like nowhere today, the US government had helped us using our health mandate and engagement to develop a lot of effective models and approaches which can be shared with others and multiply our joint success. As concrete example, I will mention the change of paradigm toward decentralization from a context with many plans and many actors to one where the departments have one plan and many partners while promoting good governance, coordination, and synergy at local level. It is about starting from the base, planning from needs to resources to priorities, harnessing underutilized resources, increasing public-private partnership, increasing complementarities, synergy and accountability, fostering local empowerment, governance, coordination, and democracy towards peace and stability. The vision behind this is to achieve effective decentralization through integrated departmental planning and strengthen management system to provide quality health services. I have to admit that decentralization is not only a word, but a very, very long process. I want to stand as a proof. The health clusters, initiated and supported by MSH, which are held at the departmental level, particularly for the questions related to HIV/AIDS. And I have to thank the USG team for their support. I want to stand as a proof the fast resumption of integrated primary health care at institutional and community level after the earthquake, due to real implication of the community served. And I invite you to take a tour and read the posters, which will give you a better sense and flavor than my simple words. I still want to stand as a proof the outstanding results obtained rapidly with the performance-based financing approach of not only for the private sector NGOs, but in some targeted public sites where immunization went from 40 to 85%, as well as some maternal health, family planning, and HIV/AIDS indicators. This includes management system indicators for the public sector, because we believe at MSH that stronger health systems lead to better health impact. I still want to stand as a proof the effective supply chain system carried out by two other projects, managed also by MSH and financed by USAID, FCMS, in support to the Ministry of Health and partners, managing and distributing HIV commodities and drugs, and by LMS for family planning commodities despite of the disaster, thus avoiding any stockout at site. These are only illustrations to ensure you, as opposed from what I said at the beginning of my remarks, that I do not come from nowhere. I'm coming from a country where, regardless of all the negative aspects, there are still men and women who have only one desire, one mission, making a real difference in the life of the most underprivileged and vulnerable populations. We definitely should adopt an approach of primary health care plus, without excluding the specialized aspect of care. But the primary health care plus will include education, microfinance, or micro-entrepreneurship. If we do not want to break the circle, population in good health results in increasing labor force, in increasing economic growth towards development, and in avoiding to lead directly towards the new concept of misery plus. I would like to take on my own and finish by synthesizing what is missing. People of Haiti, government, donors and friends of my country, we miss a common vision. We miss the leadership and the guiding principle aligned to all actors. We miss the concept of priorities at all levels. We miss the concept of accountability and focus on results by all actors. We miss the concept of effective coordination and synergy. I will finish by a personal act of faith. I believe in the adoption of a common vision, and I'm calling for one integrated national planning. I believe in the concepts of going towards people, understanding what they live, and building on what they positively have. I'm calling for decentralization. I believe in the spirit of partnership and coordination.